Tamara Allen, Allegheny College of Maryland. Today's date is 10/18/2025, and I will be inserting a intermittent catheter on a female. Hi. I wash hands and provide privacy. Hi, my name is Tamara, and I'll be your nurse for today. Can you tell me your name and date of birth? Melanie Brown, 10/18/81. Can I check your armband? Thank you. Melanie Brown, 10/18/1981. How are you feeling today? Good, good. So I received a doctor's order to insert a Foley catheter inside of you because you're retaining urine. Is that okay? Okay. So first I'm going to provide peri-care, and then I'll get everything set up to perform the catheter insertion, okay? Let me get you comfortable, okay? I put on gloves. I adjust the bed, make sure the bed is flat, dorsal recumbent position, and make sure she's covered up. And so I wash hands, apply gloves, and I performed peri-care on her. Right after I performed peri-care, I threw gloves away, washed my hands, and I'm going to grab my catheter kit. Before I grab the catheter kit, do you have any allergies to latex or iodine? No allergies? So no allergies. So I'm going to grab the kit, okay? I'll be right back. Okay. Knock, knock. Grab the kit. Hands are washed. I apply new gloves. Before I open the kit, I check the date, the expiration date, 10/27/2027. Perfect. It's not expired. Okay. So with my new pair of gloves that I have on, I'm going to adjust her covers, her blanket, and I'm just going to expose your urethra, okay? You're still going to be covered. So I have her covered. And I would have the catheter kit on a bedside table, okay? Sanitized. The bedside table would be sanitized. And so I'm going to take this catheter kit out. Maintaining sterile technique. I'm only going to grab the corners of this kit, about 1 inch. Making sure not to touch the inside. It is sterile. Okay. And so, by the way, this bag is the receptacle. So now I'm going to grab the drape that goes under her hips, touching only the corners, shiny side down. Miss Brown, can you go ahead and lift your hips for me? I'm going to slide this under your hips. So I grab the drape, touching the corner, shiny side down. Miss Brown, can you lift your hips? I'm going to put this under her hips. Making sure not to break sterility. Okay. All right. So then I also Apply the administrative drape over her. Now I grab the gloves. These are sterile gloves, so you have to be careful when opening them. Be careful. I'm going to start with my dominant hand, which is my right hand. Pinch the inside. The inside of the glove. Then grab my left hand, which is my dominant, my non-dominant, I'm sorry. Okay, now these are sterile. So now I can remove my kit. Make sure it's in the sterile field. Okay. I'm gonna hook my normal saline to the balloon port. I'm gonna open up my iodine, put that on the side. And my lubricant, I'm gonna open it and I'm gonna pour it into the tray. The tray is still sterile, so I can pour the iodine in there, okay? Put that in the receptacle. I'm gonna remove the blue packaging to the urinary catheter. Throw that in the receptacle. Mind you, this is my non-dominant hand. So my dominant hand is this one. And I'm gonna put the catheter in the lubricant, okay? While that's in the lubricant, with my non-dominant hand, I'm gonna hold the labia, spread the labia open, and I'm gonna take one swab, and I'm gonna swab away from me in an up-down position, up and down, throw that away. Another swab towards me, up and down, throw that away. And then the middle, up and down, and throw that away in the reciprocal, okay? So then afterwards, I'm gonna take the catheter, 2 inches from the tip. I'm gonna insert 2 inches. Until I see some urine, whenever I see urine, I'm gonna insert 2 more inches, okay? So, Ms. Brown, I'm gonna insert the catheter. Try to bear down for me like you're trying to have a bowel movement, okay? I'm gonna feel a little pressure, okay? 1, 2, 3. Okay. And I see some urine is coming out. So then I'm gonna hold the catheter with my non-dominant hand. With my dominant hand, I'm going to inflate the balloon. Slowly. Okay. Take that, throw that in the receptacle. Now I'm gonna tug just to feel some resistance to make sure it's in. Yep, there's resistance. The balloon is inflated. And there's urine coming out. So now I'm gonna secure the bag. I'm gonna secure it to her leg with the secure tape. Secure that. And then put the bag to the side. Put that on the side of the bed. Take my gloves off. Wash hands. Apply a new pair of gloves. Discard everything. take that off, apply another pair of gloves, and do peri-care. And right after peri-care, remove gloves, get her situated in bed, raise the head of the bed, make sure the covers, make sure she's covered, and hand her a call light, and that's the Foley catheter insertion completion. Thank you.